Hello and welcome to Sex Unwrapped, a podcast by Saving Lives UK, with myself, Tom Hayes, a Saving Lives trustee who's been living with HIV for 10 years, and Dr. Naomi Sutton, an NHS consultant and star of Channel 4's Sex Clinic.
Sex Unwrapped is a podcast exploring everything sex. Together with our guests, we'll be exploring sex, sexuality, sexual health, and sexual pleasure. Basically, everything to do with sex. So slip into something more comfortable and let's go. We are incredibly honoured and delighted to have Bruce Richman joining us for this podcast. He's the founding executive director of the Prevention Access campaign, which launched the huge campaign called U equals U, which means undetectable equals untransmittable. And it's been a global success at hopefully at helping to reduce HIV stigma and for people to understand that when people are on treatment, they can't then pass the virus on to sexual partners. In 2012, 9 years after his diagnosis, Bruce learned U equals U, and after recognising that people with HIV and the public were not being informed about this groundbreaking science, he joined with activists and researchers to clear up mixed messages about HIV sexual transmission to ensure that the science reaches the people and as the intended benefit. Bruce has worked in philanthropy and social change for over 25 years, developing cause-related initiatives for high-profile people and brands.
Thank you, Tom and Naomi. It's great to see you both. I love you both, and we've been in this for so long together. So it's really nice I just enjoying getting a chance to chat with you. So I appreciate it.
How are you coping during the pandemic?
It may not seem this way, but I'm really an introvert. So this is kind of like validated my existence is okay, like to be alone, and I don't really have that much fear of missing out like a lot of people do. But and I like quiet time. But at this point, after a year, I definitely am. Something's changed in my brain. I think I just kind of especially the last couple of weeks, I kind of just lost it a little bit. But I'm so lucky. I have no reason to be really that frustrated. I have food and a bbig television, and I have good health care, and so I'm very lucky. And I live in a place where the vaccine rollout is going well, and so I can't really complain. But I can't wait to get out there and hug.
Yeah.
Let's just say hug.
Yeah, we're definitely we're all missing hugs.
Yeah, it's come to a point where I drive to a different supermarket now just to feel something. So
yeah. Oh my God. Wait, Tom, you go to supermarkets? I haven't been to. The first supermarket I went to was 2 days ago because it was just after the first vaccine, and I couldn't find anywhere to eat that was even open, and I was terrified to go into the super. I was like rushing around. I had 2 masks on. It was like the first time since September that I had actually been in somewhere, and it felt like it was weird. It felt like I was doing something wrong, like I was in this dangerous movie. And I don't know, I think I'm definitely losing it a little bit. Going to a supermarket should not be
terrifying.
Still like a terror for me,
So, but your work, I'm sure, has continued throughout the past 12 months of restrictions and global health crisis. HIV care continues. U equal U campaigning has to continue. So, how's that been going for you?
I mean, that's why I get up every day. That's why I get up. I mean, it's incredible. This movement it's now. We started it, and as you know, because you were a part of from the very beginning in 2016 in the summer, and now almost 5 years later, it's on, over half the countries in the world. So 102 countries have U equals U partners that are working to get this message out. Over 1,000 partners, and it's just amazing. I mean, the best part of it is that I get to interact daily with these amazing, pioneering people who are the first in their country to come out and say, I'm living with HIV and I cannot pass it on, and to say this in a country that's homophobic or transphobic, all these issues, so under such puritanical values, like in the United States, and sex negative, and they come out and are so strong to say this. And sometimes it's not just against their own like health establishment, it's sometimes against their own communities who won't let them say this and are pushing back on them. And so I'm meeting these just resilient innovators, originals who are like, really changing the world and changing what it means to live with HIV in their communities. And I'm in awe all the time. I'm in outrage still, a lot less outrage than I used to be, but awe a lot. Yeah. So that keeps me going. I love it. I can't wait to get up and like look at, usually it's a lot on Twitter. I'll find out something's going on Twitter, and then there'll be emails and messages on, from different social media outlets with people contacting me about what they're doing and sharing ideas and strategies and wanting different kinds of campaigns or support. It's just, it's mind-blowing. It's still mind-blowing after 5 years,
Bruce, can you tell us a bit about how this campaign started? So go right back to the beginning, because I remember when I was first training in HIV, the Swiss statement came out, but about not being transmissible, but nobody really believed it. And it was only really a couple of years ago that BEVA, so British HIV Association, actually took it on board, and we now run with it. And I know lots of people were very nervous about saying ultimately you cannot pass this virus on. So tell me a bit about how this all became, how it all started.
Yeah, the origin story.
Yeah, the origin story. Well, yeah. I was diagnosed in 2003, and I knew that treatment would keep me alive. I knew I was in a place, I was lucky enough to have access to treatment, and the treatment had, in 2003, it was working to get us to undetectable. And my doctor advised it, and I didn't want to go on treatment. I didn't want to deal with having HIV. I didn't want to even admit to myself that I had it. I didn't want to take a pill every day that would remind me that I had HIV. And I just didn't go on treatment. And I tried to ignore it. I was so afraid of passing this on to someone that I would love. So I didn't love. I completely shut down. There were no second dates, always because of me. I always pulled away from people. And something changed in 2012. So 9 years later, when I had a situation where a condom broke, and I was terrified, someone else was terrified, and that I might have passed this on. And my doctor said to me, it's impossible. There's a study, he's told me about HPTN 052 and the Swiss statement. And I said, are you kidding? That's huge. I mean, the medication, stops it, because I had just started medication 2 years before, because I got sick and I had to take medication. So I've been on medication for 2 years and undetectable, 2010 to 2012. And I said, so what I've been taking for the last 2 years, like I've been undetectable and I couldn't pass, it was impossible. He said, yes. I said, will you put that in writing? And he said, no, but I'll tell anyone you want to date or have sex with, and so I started doing, talking to people and, talking to journalists and researchers and heads of medical associations, because I was like, how could this be true? There's like nothing in writing that says this except for the Swiss statement, and so over the next couple of years, what I started to learn is that there were people who were waiting for more science, for sure, for published documents, but there were also plenty of people in big institutions who knew this was true and were having discussions, at conferences and sort of not in public, to say that we can't get this out. This would be a public health disaster, because people with HIV will stop taking their medication, and they'll think that they're still undetectable and they'll pass it on. It'd be a public health disaster. I heard that term so many times from similar kinds of people. And then what I also started looking at or realizing is that heads of clinics and other folks who would say to me, we know it's true 100%, but we won't tell people. They were usually really privileged people who were telling people on a case-by-case basis, like myself. So, one clinic, I won't mention it, they're on board now, but the head of this clinic in the United States, he said to me, I only tell the people who I trust will be adherent, white, cisgender, gay male running the clinic. And I was, and serving mostly low income folks in a part of the country that has very high rates of transmission. And so I have a lot of stories like that before we launched, right? Where I just kept hearing this and people were agreeing. And so we decided we had to do something. We had to do something. When you know this, you have to share this information. It was like, Tom, when I saw your video in 2016, you're saying it, and I was like, who's this guy saying this is true? Like, I got to know him and help. And so we, formed this coalition and talked to the researchers from the major studies, like principal investigators from HPTN052 and the partner study. The author of the Swiss statement joined us. And we created this consensus statement that would confirm U equals U was true. And so our idea was we would take that statement and we created this advocacy video and our voices and go out and change the narrative about our bodies. So we'd say, look, let's recruit influential people and institutions to join us in confirming what we knew is true. So we launched the campaign with that statement in summer of 2016 to coincide with the publishing of HPTN052 and the first part of Partner. And we just went at it, and we the first really big endorsement was New York City Department of Health and the head of the Division of AIDS in New York City. So that was huge. We were like, oh my God, New York City's on board. New York City is saying this. We're done. Everybody's going to say it now, oh my God, they're on board. And then this other national organization, the US, came on board, and Terrence Higgins Trust had their campaign blazing, can't pass it on. But it was a shit show. I mean, it was a real fight. It was the biggest battle that I've ever been involved in, and some of the nastiest treatment of people that I've ever seen. And I'm glad I saw it, especially in my own country, how people with HIV are treated, not just by the health establishment, by their own communities, because it woke me up. I mean, I've always been in social justice since I was a kid, but to be a part of a community that has been so marginalized, maybe the most discriminated against of any other community, because we are from so many different backgrounds, and to be able to fight for us was just, it was I think the biggest honor and blessing of my entire my life. So that's how it started, 2016, and boom, it just took off. I'm just catching my breath now.
And how many countries in the world are you in now? So you said nearly over half of the countries?
Yeah, 102 countries right at this point. Yeah, it's every continent. It's just all over. So you think, I mean, there's a lot of work to do. When you think we have 4 full-time staff in the United States, right? Just for the United States to get movement here, there's a lot. We've got people in all these countries on every continent, but they also need support. They're not, these are not places that are, very few have country buy-in at this point. There's only less than 10, I would say, that have country support from the health ministries. So that's what we're working on.
Just for people who might be listening who don't understand, because I know people are banding around Swiss statements and hate what Bruce was saying was there's a vast amount of evidence, huge numbers of sexual acts without condoms with people who are in serodiscordant relationships. So one has HIV, one doesn't, and it's been proven time and time again you can't pass this virus on. I guess from a medical point of view, the reason it's very difficult is to prove a negative is much more difficult than to prove a positive. So you only need one case in that cohort to then go, So I think that's why it took so long for the medical, the medical bodies to get on board with it. But for people listening, there's just so much evidence out there to prove this point.
Hundreds of thousands of hours of condomless sex.
Exactly.
People having fun, people enjoying themselves, people enjoying their lives, and no linked transmissions from partner to partner. It's incredible.
Yeah, it is incredible. Bruce, sorry, it interested me about why do you think that was an American phenomenon, or do you think that was kind of worldwide, the fact that doctors weren't, expressing this view to their patients?
Most of my conversations were in the US, some were international, but I think there's so many reasons why people weren't sharing this, and this could be a conference on its own, but I think there were some folks, like many, who were feeling like, let's wait for more data. We don't want to say anything before, we have just an overwhelming amount of data before we say this. And so I think, and then there were folks who just were looking, there's all these, they were independent studies, and it's not like there was a conclusion based on all those studies. U equals U, before U equals U. It wasn't like these studies were coming out independently and were, promoted by the journals that, in the journals by the institutions that support them. So it wasn't an individual doctor somewhere, a clinician, typically would not look at these and draw a conclusion on all the data that, from the back to 1996. But so there's a couple of reasons. I think in the United States, a lot of it is, I think there's a paternalism in the medical establishment and in the community that, you decide what's right for people with HIV rather than invite them in to decide for themselves and give them the information. So especially because people with HIV are mostly already marginalized by the healthcare system, and they're communities that are typically left out, and so I think that definitely that there's that stronghold of that kind of opinion in the United States. And what was so interesting about it, though, is how honest people were about it. They were just like, oh, we don't think people will understand. Like, I literally, like, saying that to me, like the term unsophisticated consumer, I heard from a big public health department in the United States. And I was like, after the call, a friend of mine was on, colleague, I was like, did he just really say that to me? I'm an activist. What if I taped his conversation, and blasted that to everybody? Like, what? That's not okay to not tell people because you don't think they're going to understand. You don't do that. You teach them in a way that they will understand. Yeah. And I love this guy. Like, I consider him a friend now. That the person who, one of the first people to tell me that. But it was accepted in the field to do that, to decide for people with HIV rather than give them the information to decide for themselves. And I do think that may be something that's very American, because that happens still. That happens, and we have small groups of people who represent 1.1 million people with HIV and make decisions for 1.1 million people with HIV with zero input from them. So you even have us doing it to our own communities of like, we'll decide for you rather than actually sit down and listen, which is one of the greatest things to do, is to sit down and actually listen to what people need and to get feedback from people and co-create things rather than be dictators. So I think that could be cultural, but we changed it. We took away permission from these people, whether it was the medical establishment or our own community who were fighting to stop this message. We did it. We went around them. We went right around them. The groundswell of social media. Also the international support really helped us. So we were able to say, like, often, like, look what they're doing in the UK. Look what Saving Lives is doing. And Terrence Higgins Trust and National AIDS Trust. I mean, there's so many, AIDS Map, all these groups, shouting this from the rooftops over and over again. And so we were able to push folks to some degree in the United States by showing look what's happening elsewhere. Look at this commitment to people with HIV. Look at this commitment to ending the epidemic. Because, if you're sharing the U equals U message and more people are getting on treatment and into care, they're staying healthy and they're not transmitting HIV, which is the most effective way to end the epidemic, is by helping people get into treatment and into care. So long story short, I think the US is a unique place to be working and trying to getting this message out. And you're like Disneyland in the UK. You equals Disneyland. You really are. I think
it hasn't always been that easy over here, though. I mean, I know at the beginning, when I was diagnosed 2011, the doctors and nurses were already talking about the rumblings of Swiss statement and some of the early studies that were coming out. But again, they weren't comfortable saying it. When Beaver were deciding whether to endorse the statement, there were people that said that it wasn't the right move to make. Often citing people who didn't have treatment literacy, which is another way of saying they didn't think they had the technical or competence to understand it. It's a really simple message. If you take your pills, you can't pass it on. Like it's not a complicated message. It's not asking people to remember their blood work details and stuff. It's just take your pills, stay undetectable. You can't pass it on. I think one of the ones that stuck with me is I do sometimes do clinic support, and I went to I was chaperoning somebody in clinic, and the doctor was skirting around the issue of U equals U. I told the patient I was supporting then and there what their undetectable status meant, and the doctor looked horrified. So I hung around afterwards for a bit, and the doctor said, "But U equals U is only 96% effective." I said, "Where did you get the information from?" I saw it in a study or an article about a study like 5 years ago. So I know doctors can't always be up to date on the latest information because there's so much thrown at them. But when you're looking after a cohort of HIV positive patients, learning about transmission has got to be fairly basic, because you're sending that person away not knowing the right information to make their own decisions about their own health.
I think that's why it's so nice from a doctor point of view. I love it because I'm a very simple soul. Data doesn't stick in my head. I love U equals U. It's dead easy to explain. It's easy for people to understand, and it's a fact. And medics, we love facts. We love reassuring facts. So it's a lovely thing to say. But what I really love is telling people in clinic and seeing their whole demeanor change. It's such a rewarding thing to be able to tell people that assurance behind it. I mean, it really is it's a game changer.
Yeah, I hope everyone has that opportunity in this field. When you have the opportunity to tell someone with HIV for the first time that they can't pass HIV on, that they can have any kind of sex that they want without any fear at all. They can have babies, conceive babies without having to worry about alternative means of insemination, and that fear that's always been present in our intimate lives, in those moments. And one of the best, there's so many great moments of people coming up and showing their wedding rings or pointing to their babies and saying, "This is because of U equals U." And there's a woman, Bridget in Canada, woman with HIV, who stood up during a presentation. It was 2017 in the spring, and she said, "Is this really true?" I said, "Yes, it's true." And she said, "Is it really true?" She started crying, and I started crying. I actually cried now when I think about it. And I said, "Yes, it's true." And she said that for 25 years that she'd been having sex with her husband with a condom, she's always been afraid for 25 years. Yeah. And so she immediately texted him and ran out to go home. I'm sure they had a great night. And that was in Canada. And then in Japan recently, on a panel with this, God, it was powerful, with this, just everybody had these such heartbreaking stories of stigma. A woman who had, this is sort of digressing, but just to tell you about the stigma, but the woman who was engaged and to, she was in her early 20s, engaged to a man, was really afraid to tell him about her status, and she did, and he was okay with it, and they had a baby, and she got pregnant, and she knew about U equals U. This was just 3 years ago, but the mother of the young man forbid him to marry her, so she had an abortion. 6 months left after that, the mother called her and said, she apologized. And she said, "I'm sorry." She had learned that she couldn't have transmitted this to her fiance, and that, but it was too late at that point. She had lost the baby. I'm gonna cry. She was in a new relationship, but it was, anyway, there were a lot of those stories in Japan, but after this presentation, this couple came up to me. The HIV negative partner said that his partner, who was living with HIV, was really having trouble believing that this was true. He wanted me to try to give the partner with HIV confidence that he's okay, that he's not going to hurt his partner. And and there's just, these conversations are so intense and they're so meaningful, and it's like I love having these conversations, and then I get so outraged that it's not happening, and I shouldn't say it's not happening. Our most powerful agencies in the United States are doing nothing to facilitate these conversations. And then you get people who are suffering. They're really suffering from stigma, internal stigma, the external stigma, that we can do something about it if we actually share this message. It changes it. It also, we could do, there's so much we could do. So it's like, you see me through this whole podcast is like, I'm excited, I'm inspired about what we're doing, and I'm still full of outrage.
So you've seen It's a Sin then?
Yes.
It's been showing us. It was, obviously it's British, it showed in the UK first, but for the first 2 weeks, there wasn't any information about how HIV has changed afterwards. It wasn't until, I think it was Thames Sick and Trust and National AIDS Trust got involved, that they started putting a short disclaimer at the end of the show where you could find more information. It's just, it is missed opportunities by corporations and by government bodies that have the platform, that have the time, and have the money to educate, isn't it? It's one thing to draw people in with a drama or an article, but it's another thing to use that space to educate. And I think that's something we all need to keep continuing to campaign for.
Bruce, do you think the reason people aren't sharing this message is because HIV is fundamentally a sexually transmitted infection? Do you think it's tied up in the whole stigma around sex, or do you think there's some other reason?
I think sex negativity is a big part of it. I think homophobia is a big part of it, and serophobia is a huge part of this as well. Like, this is a world, I think the US is really focused on keeping HIV negative people negative, and really focused on their health at the expense of our health, actually, like overprotecting HIV negative people.
But
so
how do they expect to do that at the expense of, because part of it is obviously spreading that message, because I understand in America you don't get free access to medication.
Well, you can through the Ryan White program. There's a program that,
okay.
and another program called ADAP, where you can get really good, actually, care at low to no cost. But it's I think that, the focus, and it's interesting. I was just going through some of my old emails from the beginning of the campaign, and like the focus on the focus on PrEP in the United States is really, it's important. PrEP is absolutely essential, but it kind of has overridden and left, treatment even in the closet. The focus on getting people into care and treatment, and where's the movement around that yet? Okay, we have over 400,000 people who aren't on treatment and in care in the United States. Like, why aren't we shouting about that? But we're shouting about PrEP access, which is important. I'm not saying that, you don't want to upset PrEP folks, because they're doing great work, and I don't want to, but at the same time, like, people are dying because they're not getting treatment. They're dying because of the HIV stigma in this country, and their lives are at risk every day that they're considered a risk. And you don't have that movement yet here, except for U = U, which is very much we're really an underground group. We're not, like, if you look at the folks who are speaking up, most of us are not running organization, like large, or the voices that we're not the either of you, like big names in the field, and Terrence Higgins with Ian and Matthew and all these folks, and Laura. We're kind of like under people who are just coming up into the, like, and I don't know, I think it's also, there's funding streams for specific issues in the US that get a good attention. There's criminalization, and there's great work around criminalization. There's funds for aging now, which is really important. Funds for aging. There's funds for transgender issues, transgender health. And there's organizations are very savvy in terms of what they will focus on and promote in order to get, funding and to do really good work as well. But, there needs to be a U = U stream. And it needs to be kind of a funding stream. And if U = U, we need to celebrate U = U here as well. it's sort of like when it comes out, it's just like in paragraph 5, hidden in paragraph 5, as if it's just like an everyday thing that everybody knows. Yeah.
I should just, again, just for people who are listening, because we're mentioning the word PrEP. So that stands for pre-exposure prophylaxis. So that's people who are HIV negative, but are deemed high risk can take a medication, antiretroviral medication, to prevent them from getting HIV. So, and that's available if you're in the UK and listening, that's available on the NHS now, but you can buy it online. But again, sorry, just to explain what that was. I realise we keep using lots of terms that people might not understand.
PrEP and U equals U see quite similar amounts of stigma in the gay community, especially on apps like Grindr and Scruff and things, where people were quite often referred to people as Truvada pores, or have misplaced trust in people who are claiming equals U and say that they're not actually taking a medication. Why do you think, from a community that should know better, the gay community, why do we still have a lot of distrust around things like PrEP and U equals U? And how do we tackle that?
Yeah, I think there's still so much internalized, stigma and shame around, around being gay and around sex, and, feeling, that having a lot of sex and having multiple partners is something that's like naughty, and that we shouldn't be doing, or naughty, not naughty in a good way, and so I think that it's people, it's our human nature to judge and to organize into groups, into different classes. And I think that by shaming people who are using PrEP or who are undetectable, that's a way of feeling better about oneself. It's also a way of like feeding in and fueling the internal shame and negativity about sex. That so many of us grew. I still struggle with that as well, even though I talk about sex every day. I traveled around the world talking about sex without condoms and just all kinds of sex, and I love it. But I also think that I think there's still, in terms of fear around people with HIV, I think that the stigma against towards people with HIV is runs so deep, and it's been in a part of people's consciousness about HIV for almost 40 years. So I think that there's still just going to be, whether or not it has anything to do with sex negativity or shaming or scapegoating, there's just going to be fear around contagion when you're talking to someone who's HIV positive and saying they're undetectable. So people may rationally believe and know that the undetectable is true, and that U equals U is true, that they can't pass it on, but then emotionally they're not going to go there. They're still going to be afraid to actually have sex with someone who's undetectable, because that gap between the mind, and the heart is such a big, is so wide. People are, it's just human nature to find reasons to judge, and to blame. We're like judge making machines, and I think it's judgment around sex is such an easy thing to do, to latch onto, because it's almost sort of it's sort of accepted to be that way in society, to be judgy about sex.
I do think, just shout out to human beings out there who are listening. I do think we're getting better with regards to judgment. If you look back even just 30, 40 years, just being gay was seen as a huge issue. And now transgender people, I think, are going through probably the similar thing that homosexual men went through back in the 70s, 80s. So I think we are changing, but I think it's always education, isn't it? And people at the front, like you, Bruce, who are pushing those issues and shouting about it, and you, Tom, obviously, getting out there and shouting about it. And I think being vulnerable and being able to, I guess, in a way, expose yourself. Bruce, don't start. Being able to be honest, I think, does change people's views, and it then shows you as a human being, and being frustrated and being passionate and, getting annoyed with things. Well, that's great, because it shows how much it means and how much you care about it and how much everybody should care about it. And I hope if anybody's listening to this, they go out and ask everyone they know, did you know about U equals U? And, let's spread the message. And, I love human beings. I think we've got such capacity for resilience and love and ability to change. I just think we are often lacking in education and sometimes lacking in our own, emotional capacity. But I think that can be learned.
I think a lot of it is the way we communicate needs to be better as well. I mean, we're all guilty as it working in HIV that we'll talk about the CD4s and viral loads and mention acronyms like PrEP and not explain it. And like as you point out in this video, Naomi, you've been explaining the acronyms to everybody. But like U equals U doesn't need to be complicated. Like THU, when we can't pass it on, doesn't get more simple than that.
Yeah.
Now, communication needs to be fun. It needs to be sexy. It needs to be easy to understand because sex is fun. So our messaging around sex should be fun. It shouldn't be clinical. It shouldn't be complicated.
Also, what I love about doing my HIV clinic is not delivering CD4 count of viral loads. It's having a chat with human beings and, I guess asking them how the HIV is affecting their life or their sex life. Or, I think most human beings connect through ways other than data or whatever. So which is why Bruce, I love your passion. I just love the fact that you get up there and shout about it, and it's inspiring. It really is.
Well, thank you so much for joining us, Bruce. Where can people find you and your work on social media?
Thank you for having me. It was great to talk with you both. You can find me personally on Twitter at BR999, and our website is www.preventionaccess, and that's ACCESS.org, or you could find us at u=u.org, with the equals spelled out.
Awesome. Well, thank you so much for joining us. It's been an absolute pleasure as always, and I can't wait to see you again at a conference sometime soon in person.
Oh, I can't wait. Hug you both. Yeah, and thank you for your work. I mean, both of you, you're bright lights in this movement since the very, very beginning. Tom, I still sometimes play your videos on our playlist, so sometimes I'll still refer to that because it was one of the earliest that we saw, and it was awesome. So thanks for your leadership, and stay well, both of you.
Oh, thanks, Bruce. So we're very lucky to have the wonderful Becky, who's also recorded a podcast all of her own, but we thought we'd pop a bit in about U equals U. So Becky, please explain to us, what is U equals U as a person living with HIV? Tell me what it is and how you explain it to somebody else.
So I would say U equals U means undetectable equals untransmittable. So someone living with HIV takes their medication and it suppresses the virus in their body, meaning the virus isn't acting like it should. So it doesn't attack your immune system anymore. And it means that you can't pass that virus on to sexual partners. So what that means for me is, I think, freedom from having to think about HIV, freedom from worrying about my physical health, and freedom from knowing that my partner can't contract HIV from me, and any future children I might have as well.
Yeah, so it reduces, I guess, that worry, that fear that you're going to transmit. Because I think for a lot of people that stops them having sex altogether, or used to before this campaign came out. People would just stop dating.
I think it gives me freedom of choice. So because I am protected, I feel more able to tell people about it. But then also, I don't have to tell anyone about it because there's absolutely no risk of transmission. So if I just want to have sex, I can do that without having to think about HIV transmission.
It's true. The conversations about U equals U and PrEP, I think, have made it a lot easier to share your status with new people. Has it felt like that for you?
No.
No?
To put it bluntly, conversations about U equals U and PrEP have not reached heterosexual men at all. There's not a single man who I have met who hasn't already known this information. They just don't know about it. So unfortunately, when I say, I think the campaigns are great and it is really good that they're out there, but they're not really reaching heterosexual communities at all.
How do you think we need to, well, obviously we need to change that, but how do you think we do that?
I think it's a case of visibility, having those campaigns out there that are targeted at people who could be affected. You know, people do go to sexual health clinics, but the younger heterosexual population, they'll just go and they'll just do a self swab and they'll just go in and leave. They won't even look. And if on the poster for PrEP you have 2 gay men, and if on the poster for about get tested for HIV you've got 2 gay men, they're not even going to read it because it's not to them. And most sexual health clinics have a male and female area. Not all of them, but a lot of them do. And if it's not there in the female area, they're not going to notice it. Now, I know at my clinic they do, but that's because Naomi works there. So posters up. But I don't think that's the same for everywhere. They don't get offered tests. You know, I've been for a sexual health checkup and they've given me 1 swab. And I'm like, okay, I'm going to have another swab. And they give you another one. And I'm like, I'm going to have another swab. I feel like you should, you know, a bit ashamed because they're not asking and you feel judged. Whereas you should just offer it to everyone, you know, just say how many you need, or, you know, or with the HIV test, just say the way you pitch it is part of the routine, part of the tests you do, not as an optional extra. You know, I think that's the way it's pitched. Is like, oh, do you want to you don't have to have a HIV test, but you want one. So it should just be like, we're going to test you for this, and this, and you have a choice to opt out of any of them. You know, rather than, you know, the other way around. I think that would be a lot more helpful.
I think a big part of it is also, I mean, me and you are the same age, Becky. We missed the only big UK campaign around HIV, which was obviously the Tombstone one, which is dragged out every time anyone ever talks about HIV in the media. But there hasn't been anything that updated the public in such a huge way ever since. You know, U equals U is amazing, but like we don't talk about it on a national scale.
No, that's the only reference to HIV even I knew, even though I was too young to remember the adverts, was the adverts, because that's the only thing I knew about it. And like you said, they play it every time. They always sneak in a couple of seconds of that clip on the news every time. And it's just like, yes, we all remember that. Like, let's have something new, you know, and it is good. I mean, I am glad every time I get asked to do something on the news, because I feel like, although I might not be representative of the main body of people who do contract HIV, I'm representative for people that don't think they're going to get it. So the ones that are less likely to be tested. So therefore, at least, hopefully, that will inspire some people to be tested.
Yeah.
Well, thank you very much, Becky. Please let people know where they can find you online.
You can find me on Twitter at pos_woman87 or Instagram at rebex_101.
Thank you very much for joining us. Bye-bye.
Bye.
So that's today's show. Thank you for listening to Sex Unwrapped, a podcast by Saving Lives UK. Please remember to subscribe to us on Apple Podcasts or Spotify, SoundCloud, or wherever you get your podcasts.
Saving Lives is a UK charity committed to improving the sexual health of the nation. To find out more about Saving Lives UK and to find out where you can get a sexual health or HIV test, head to savinglivesuk.com.